Bismillah ar-Rahman ar-Rahim. Assalamu alaikum wa rahmatullah. Welcome to this presentation. I will be presenting a healthcare vision. This is a proposal for a project that the Muslim community could consider for the UK, a way to better serve our community in a safer way that's connected with taqwa and connected with healthcare, afia, and well-being. Remember, medicine, afia, well-being, these are Islamic sciences, these are our tradition, this is like a sacred knowledge and a way that we can serve our community. Currently, our community isn't being served. We're not serving ourselves in the best way. And I'm sure many of you have had personal experiences with healthcare where you just think, I wonder if there was any other options available. I wonder whether I could use my Islamic deen to better take care of myself and attain afia, and the healthier we are, the more we can worship Allah Almighty. So we really want to preserve our health as much as we can and for the community. So we're looking at integrative health centers based on health, not sickness. At the moment, the model is whenever you're sick, you go to the doctors. But we want to preserve health. You don't want to wait till you get sick. Many symptoms start when someone is actually quite sick, and a lot of the symptoms and the background work's been going on for years or decades. You look at someone who's become diabetic, often they're pre-diabetic, and before that there's insulin resistance, they might have weight issues, but it's not necessarily picked up, and they're waiting till they're pre-diabetic or diabetic. But if there were interventions taking place earlier, that illness might not develop, and that's an Islamic approach. Prevention is better than cure. Number three, in Islamic ethos, we want a place where Muslims are reminded of Allah Almighty, they're reminded of taqwa, they're reminded of who they are and their identity, and they're constantly in this state. If we think about it, healthcare is one of the times where we're tested. We're tested with our health, we're tested at this difficult time. And for Muslims at that time, we really want to be reminded of having sabr, having shukr, being reminded of Allah Almighty. We want to have places where we're passing away, we're dying in a hospital or community health center or somewhere like that, that we're supported as much as possible to be in the best state to meet our Lord. And we want to offer these facilities to our Muslim community. Number four is being mindful of halal and tayyib choices. When you go to a hospital, for example, if someone goes there, are they served halal food? Is it certified halal? Are the medications halal? And are people having to make, like, are they kind of struggling because they're not being served properly? Number five, we want an environment which has sakina, which has shukr, which has tawakkul, gratitude, all the amazing things that Islam offers us, and all the tools that we need at this difficult time of our life when we're facing health struggles. The vision is, well, these are some brainstorm. So initially replicating primary care access. So we've got appointments like you see a GP, you get advice on sore throats, UTIs, constipation, mental health, whatever issues someone has, and they see a doctor and they get diagnosed, and then they're offered different things depending on the illness. You can have a team of doctors looking after them, team of like healthcare practitioners. They might say, okay, well, they're a bit constipated, are there any herbs they could use? Is there any, maybe they could try cupping, for example, maybe they try homeopathy. So not just reliant on medication. And one of the issues with medication is they often have side effects, they often build dependency, and in the long term, a lot of the time they make things worse. Many people are a bit concerned about big pharma, aren't they? They're concerned that there's a lot of conflicts of interest, and there's just healthier, safer ways to get better, and we want to have access to those things. So after the patient, for example, they've seen a doctor, they've been diagnosed with constipation, they need something to help them. Now they have a choice. There's a herbal practitioner there, there's a homeopath practitioner, there's some cupping, there's acupuncture. And as they've seen the doctor can help decide, is it safe for them to explore some alternatives, or do they need medication? And sometimes medication's used. No one's against using medication when it's needed, but we just want to use it for the short-term basis and when we really do need it. Number four, we want gender sensitive facilities. We want waiting rooms for men and women, different areas. People can feel safe. They can feel they can respect their attire, their modesty, the values that we have are being respected. They can see a male doctor, female doctor as much as possible. And in the waiting rooms, instead of listening to whatever people are being forced to listen to, they're offered Islamic alternatives. We've got Islamic reminders. Maybe you've got in-person Islamic chaplains there reminding people that life is a test from Allah Almighty and it's a difficult time when you're sick. Keep doing shukr. There's tasbees. People are worshipping Allah Almighty. There's wudu facilities. There's a place to pray nafil before someone goes to see the doctor to get the results for an MRI scan to find if they've got cancer or not. There's a place they can pray, or any illness, they can just pray for themselves, pray for other people, pray for everybody else in that community. I just wanted to bring up a slide here talking about vitamin D. Vitamin D is really important. It's just one of the vitamins. There's so many, alhamdulillah, there's so many supplements and herbs and natural solutions to health that we could be looking at. And just looking at vitamin D, because there is a pandemic of vitamin deficiency, it's a public health crisis, and the Muslim community is affected more than other people because we cover up more, women cover up more, but generally everyone is affected and we have darker skin in general. But having a look at this, it's really just interesting because if you look at the vitamin D levels and you look at the right side of the graph, you've got things like colon cancer, pancreatic cancer, renal cancer, MS, multiple sclerosis, breast cancer, all above 60, and they're showing that there's a 80%, 60% for decrease in those conditions just by simply taking a supplement. How many of us are getting our vitamin D level tested? How many of us are getting it checked and supplementing? And if you're not, please do get a test and please make sure that you're supplementing to a really good level. And if we look lower down, osteoporosis, so weak bones, fractures, heart attacks, and the Muslim community has an increased risk of heart attacks. Imagine you could take vitamin D and decrease your heart attack risk by 40% just by addressing this very simple intervention. There's high blood pressure, TB, low birth weight, influenza. So decreasing it by 80%, and that's probably far more than vaccines could offer somebody. And there's TB. So do have a think about vitamin D, and that's something that we could offer in this health center is vitamin D screening for people and making sure that they supplement as much as possible. It's not the answer to every health problem. People will still have health problems, and there's so much more available. I just wanted to show an example of what natural supplements, lifestyle medicine can offer people. Optimizing health, we want the center to offer dietary advice. We want to focus on the sunnah methods of eating, maybe fasting 2 days a week, having programs where people can be encouraged to look at a diet where they're fasting 2 days a week and how they can support the community and themselves in doing that, not overeating, sunnah lifestyle, sleeping after Isha, napping. And they could have facilities where the staff and patients are encouraged to do that in this health center. Shukr, we really want to encourage people to be as grateful as possible. Great gratitude is an amazing tool that we have, and it's correlated with health. In psychotherapy, they often use depression for treating depression and treating anxiety. People are recommended to keep gratitude journals, and studies have shown that if someone shows gratitude, even simply writing down 3 things every day they're grateful for, the effects can be as effective as antidepressants, and antidepressants may not be as effective as we think anyway. So there's supplements, there's vitamin D we've talked about, there's omega-3 fatty acids, there's milk thistle for the liver, there's feverfew, which was used by Ibn Sina, may Allah Almighty have mercy on him, as a treatment for many conditions, including migraine. There's probiotics, so looking at the gut-brain connection, there's black seed oil, there's ginger, there's curcumin, and some of these we recognize as Muslims that we use in our diet. We're quite familiar with some of these, but we're not really given the information about how to use them, how often to use them, and really the extensive number of conditions that simple supplements can be useful. This is just an example, it's not an exhaustive list, but we want information leaflets so patients can take away these leaflets. They can be given guidelines on how much to take and monitored. And number 5 is weight management. So, as the more we sort out our weight, the better we are in terms of insulin resistance, decreased risk of heart disease, of cancer, of many health problems, knee problems, joint problems, and diabetes, etc. Number 6 is movement. We want to talk about getting people moving, maybe having walking groups so women are feeling safe. This health center could have a walking group. Women are walking, there's organizing women's only swimming at a local center together. And things like sajda for back pain is really interesting, but the sajda position can help with your back pain. It takes all that pressure off someone's back. And we could encourage people, if you've got back pain, here's a physiotherapist, and they're going to prescribe some rakas for you to do. And you can do shukr, you can be grateful, you're going to do some rakas as part of their rehabilitation from that back pain. Support with addictions, we need to think about residentials for young people, CBT talking therapy, just a chance to break away from their screens and to get off their phones. And we know there's a huge problem with online addictions and pornography in young people. We need to address that as a community. We need to develop programs and have support centers where they can get access to the help they need. Number 7 on my slide is specialists. So the center could look initially starting off with primary care. And as we develop more and more, start building secondary care specialists into this center, again, focusing on holistic approaches, informed choices, respecting patients, being compassionate, having all the Islamic values that are so important to our character, having pharmacists around so they can advise these are the halal approved medications. We can develop our own medications, our own halal approved medications. We've got halal contrast, dyes, alternatives to Clexane, for example, at the moment. If someone needs Clexane injections after surgery to prevent them getting clots, there really aren't alternatives available. They're needing to take these injections, which are porcine based. We need to look at training. So the center could also offer training, Islamic medicine, tib. Let's teach people that. What does it mean? What does it look like? Let's get patients trained up so they can manage themselves, self-care, and take that burden of healthcare off practitioners. We also want to look at modern medicine. We don't want to negate that in any way, where it's a holistic healthcare, and we don't necessarily have all the tools to manage everything. We still need to rely on modern medicine. We need scans, MRI scans, CT scans. People may need chemotherapy, they might need antipsychotics. We still need people to access healthcare, because we're not in a place where we can treat all these conditions holistically at the moment with the knowledge that we have. And we just want to reduce conflict of interest, teaching doctors, Muslim doctors, about conflict of interest, about integrity, about being able to advise patients, having that knowledge, because at the moment, a lot of doctors are just studying at medical school and they don't necessarily have the knowledge to advise patients on all the Islamic medicine and all the other tools that we have. And I'm sure they'd love to do that. So we need to open up that training where they can access this information. Other training we would like to offer the community: anger management, trauma management. So many of our community are affected by childhood trauma. There's been abuse as a child, there's been sexual trauma as a child. We want to offer them training so they can heal and they can grow into healthy adults. We want to look at anger management. How many people are ruining their marriages because they're getting angry and there's domestic violence? Let's sort out the root of the problem. And when we sort out the root, we get better results. We need premarital coaching. We need marital coaching. We need parental coaching to support our community. We want to build a network of doctors, dentists. Oral care is emphasized in Islam, the benefits of the miswak and just oral care. If we look after our health of our mouth, that affects everything. The probiotics and the good bacteria people have in their mouth, that's been shown to be linked to so many conditions, including heart disease, cancer, and so forth. We want nurses, midwives. We want to have physios, Islamically qualified physios, like I explained, for back pain, chiropractors, hijama therapists, pharmacists. We need scholars and chaplains working with us, helping our community at this very difficult time, reminding them of all the important things, making du'as for them. And we need halal farmers so we can source halal food, tayyib food, organic, halal food. We want Muslim gyms to be associated with the center, offering programs, offering movement, walking groups, and all these activities so Muslims can get active, having prayer facilities in these places. And we want to network with Muslim schools to really build an amazing community around healthcare. As the centre develops even further, so we looked at primary care facilities, we looked at specialist facilities, we'd also want inpatient facilities, segregated wards. How many women would feel safe to be an inpatient in a normal hospital? We want psychiatric units which are there to help Muslim patients if they ever needed sectioning and help them. So if they're needing to take medication, they've been sectioned, they've got psychosis, they're getting all the Islamic support alongside the rehabilitation at such a crucial time in their life. We want to develop pediatrics, oncology, medical surgical units, and also offer respite. So many families are looking after and struggling to look after elderly relatives or young children, and we want this centre to develop into this amazing facility where we can help families and support them it to look after their unwell relatives. Any feedback about the vision is welcome, and please do make du'as that Muslim community can better serve ourselves. May Allah Almighty give us tawfiq to help our community stay healthy and well. Assalamu alaikum wa rahmatullahi wa barakatuh.